Yes, sure, you can start.
Great. Welcome, everyone. Thank you very much for joining us. This is a great pleasure to welcome you to session DO4, National Responses to COVID-19, with a focus on understanding determinants of pandemic policy and action. My name is Adnan Haider. I'm the Senior Associate Dean for Research and Professor of Global Health at the Milken Institute School of Public Health, George Washington University in Washington, D.C., United States. And I am honored to chair this session and welcome you today. I'm really excited because today we are going to talk about a topic that has pervaded our lives for the past 2 years nearly, which is COVID-19. As you all know, COVID-19 has affected all parts of the world. There isn't a country or a location that has not been affected indeed. But also, nation states have responded to that pandemic in many different ways. And of course, that depends both on internal resources, in external assistance, and of course, on global cooperation. But really what we have seen is that there are political, social, technical, and in many cases, cultural determinants which have affected the way in countries' responses to COVID-19. And not just official state responses, but also societal responses as well. So the motivations, the actions have differed. Now, what has determined this variation? What actually affects the way that countries have responded over the past 18 to 20 months? And in fact, what are some of the important political and contextual factors that we can crystallize and think about that can explain some of these responses are going to be the focus of our discussion today. We are very excited because we will get experiences from different parts of the world, but also from different sectors and from different disciplines. We will try and address questions like, what was the tipping point for a country to actually get activated against COVID-19? Or are countries actually assessing their responses to COVID-19 in an appropriate manner? But most importantly, and I want to emphasize this, what can we learn for future pandemics and the future of this pandemic from the existing situation? I'm delighted that we have an amazing panel with us today. I will invite in the first part of this session, each one of them to not only introduce themselves, but provide a 5 to 7 minute reflection from their perspective, from their sector, as to what is critical in terms of understanding these determinants and understanding the national responses to COVID-19. Once they have finished, I will try and address a few selected questions and open it up for discussions. So please, as you participate, as you hear our panelists, keep your notes, keep your questions. There is a special Q&A chat board. Please put your questions there. I will try my level best to get to as many of them as possible and direct them to the panelists. I'm very excited to kickstart by requesting Dr. Zabulon Yoti to introduce himself and also provide his reflections. He is a medical officer for epidemic and pandemic alerts and response in the Regional Office of Africa of the World Health Organization. So I think it's very appropriate that we kickstart with you, Dr. Yoti. Over to you for your opening reflections.
Thank you. Good morning, good afternoon, good evening. I'm very delighted to join as a panelist in this important session. As you heard, my name is Zabulon Yoti. I've had 23 years working on outbreaks, emergencies, and other complex health issues, mainly in Africa here. Currently, I'm the technical coordinator for health emergencies in WHO Regional Office for Africa based in Brazzaville. So, greetings to you, my fellow panelists, and my dear distinguished audience online. It's really a great pleasure for me to represent my regional director in this meeting for discussing an important topic with the perspectives on the response to COVID-19 in Africa. I'll be dwelling a lot on Africa, but Africa doesn't exist in isolation. So I'll be touching on you as well, because as rightly said by our very eloquent person who is introducing us here, no one can do it alone. It needs all of us. It's a global village. and it needs global solutions, but with local action. So I will be basing a lot on local action and continental action. As you are all aware, the pandemic has not unfolded in Africa in the disastrous way that the initial models had projected. What did we say? This was going to finish Africa, given the vulnerabilities, and we projected huge numbers. And of course, we set ourselves to plan for those huge numbers, meaning that there was already a big gap in the way we are planning, knowing that we had a lot of health systems and other multi-sector gaps. So most countries responded quickly using capacities built mainly in the past epidemics. You are all aware we have had Ebola, Marburg, cholera, meningitis, name it. So that left us with the significant capacities which we used to respond. Specifically, laboratory networks, which were established for polio, for influenza, for example, have been used to expand COVID-19 testing and now supporting the scale up of genetic surveillance across the continent. So we are building on the existing. That's the point I would really like us to go with. Nothing completely new, but building on the existing, including existing regulatory platforms. If there are new drugs, vaccines coming in, we activate those platforms so that we deal with the regulatory issues. These have helped us to move fast. Otherwise, starting in the middle of pandemic was going to be a nightmare. There has been a very strong continental coordination, underscoring the need for coordination. At the level of African Union, we have a huge coordination, and this is taken forward by the heads of states. So proud to say that our heads of states, our presidents, really got involved in this, knowing that if that level of administration is involved, all sectors will fall in. Therefore, high-level multi-sectoral task forces to guide the response, to understand the needs of these actions to be taken beyond health sector has been our strength, going beyond health sector, multi-sectoral actions. And this has helped us a lot to reduce the speed of spread. The governments therefore recognized the threat of COVID early on and moved swiftly using public health and social measures to curb the transmission. You realize we started reporting cases in Africa later. We had learned from the other continents, and that really helped us with a bit of our preparedness, specific preparedness. You know that some of the social measures taken have not been very kind to the community and to the socioeconomic status of these countries. We have had huge costs and economic costs and costs to the society associated with some of these measures. For example, the total lockdowns have really had very severe negative effects. Some countries still have schools closed, for example. Children are staying at home for all this time. Whenever they open and the cases go up and we fail to contain quickly, they close the schools again, open, close, close, open. So it has disrupted a lot. Beyond that, the economies have been disrupted. And overall, there have been, as of now, 3 huge waves, continentally, 3 huge waves we have experienced. And each is worse than the last. We don't hope for the 4th to be bigger than the 3rd, but each has been worse than the last in terms of number of cases and in terms of durations and in terms of also severity of clinical cases. But we have seen different trajectories in different countries. Africa is not just one big country. It has these 54 countries, and different trajectories do occur in these places. And as I speak now, I think 5 countries are accounting for 60% of the cumulative cases, 5 countries only. And the burden, therefore, is higher in these countries. South Africa, for example, alone accounts for 35% of the burden. And it is one of the continent's most internationally connected countries, as you are aware. And it is also one of the highest scores on the Gini coefficient, the difference between the rich and the poor. Bigger in South is one of the countries with that kind of difference. And this measure of income inequality is affecting not only our ability to respond, but also how we are going to recover and how we are addressing the other issues, health issues and other sector issues. The Gini index, that's a big disparity. We have learned several lessons, but allow me to underscore this particular one. The importance of equity is a key lesson from the response. Within countries, groups such as the low-income households and those in informal sector, the ethnic minorities, the women, the children who form the bulk majority of our population in our African countries have suffered the hardest indirect impacts on livelihoods as a result of COVID-19. You can really see this inequity occurring. Therefore, the importance of equity I would brought throughout my discussions. At the global level, inequity has been a constant aspect of access to life-saving supplies. This is very clear. Test kits, personal protective equipment, vaccines, therapeutics, there has been very clear inequity in this. For instance, several wealthy countries now, as we speak, have vaccinated 2/3 of their populations. And they were even moving forward and talking about booster doses. While in Africa, we have vaccinated only 5% of the population. Much needed vaccines only given to 5%. So we rely mostly on imported supplies. We import supplies, including vaccines. And therefore, if we have this level of inequity, we are going to lag behind. But leaving one part of the world behind then leaves the virus behind to mutate, to do more havoc, and to spread globally. So I would like us to look at globalization in the context of addressing, looking at inequities which already exist, and therefore the global threat, health security threat. Again, no one can do it alone, we can do it together. In response to this reliance on imported supplies, several heads of states here are championing now the scaling up of local production. We have seen that PPEs and things like disinfectants and so on, we quickly shifted and we started manufacturing those. But those which need high-level technology transfer and a lot of investment are those where we will still really need a lot of support. There are already examples like statements from heads of states and different stakeholders which are translating into action, such as the announcement about the messenger RNA vaccines, which are due to start to be produced in South Africa. So I don't want to leave behind the private sector, which has stepped in up as a valuable partner in response to this COVID and signaling the possibilities that are within reach. If this collaboration becomes the norm, their participants, their panelists, then we are having a good way to develop our health in a more comprehensive way. When we are talking about health for all, it needs that level of collaboration with the private sector and involving all of us. As I conclude, the potential of innovation and information technology to aid evidence-based decision-making and to expand service coverage and to access has also been showcased. Innovation, technology to improve service access. This is both in fighting, of course, COVID, and also in making sure that people still have access to the other needs. Malaria is still around, cholera is around, meningitis is around, they have not gone away. So it's through this that we are able to access the communities. For instance, telemedicine, which was rarely used here. Now I'm able to, my countries were able to take some x-rays and send to Washington to be interpreted, and then a minute later, the patient accesses the right care. So telemedicine services that are connecting frontline health workers are helping us a lot. We need to do more, it's not enough. And we need to do this for other diseases as well, chronic diseases, the other endemic diseases. Then finally, we have seen during this COVID, as in the past several emergencies, that outbreaks start and end in the communities. They start in the community and end in the communities. So as WHO, we're working very, very closely with partners such as the Red Cross, with our sister agency, UNICEF, and many other community-based organizations, with local leaders, with civil society groups, to listen to what is being said. We must listen to the communities and then target our response accordingly. Otherwise, we'll be doing our things. We don't need to do for them, but we need to do with them. So therefore, addressing misinformation and rumors around the COVID response and the vaccine rollout in particular will need deep community engagement. I thank you.
Thank you. Thank you so much, Dr. Yorti. That was a great intervention. And thank you for raising some of the very critical issues that we will come back to, both in terms of the community voice, as well as in terms of equity and the cost to society. I'm really excited now to move from Africa to the South American region and request Dr. Lorena Barberia to provide her opening comments. She is a professor in the Department of Political Science at the University of Sao Paulo. And I'm very excited that she can talk a little bit about Latin America, COVID, and politics. Over to you, Dr. Lorena.
Thank you, Adnan. It's a pleasure to be here. Thank you very much to the World Health Summit for inviting me and for everyone who's here listening to this session. And greetings to all of my colleagues. I want to start by underscoring that it's very difficult in a short time period to talk about everything that I would love to talk about, but I'm going to try to kind of concentrate my comments and hit some key points that I think are useful to reflect now as we're in the second year of the pandemic and we have a time to reflect. We're very aware in Latin America that even though we're only 7.8% of the world's population, there's been a disproportionately high toll of the pandemic in terms of the cases, which are, and if we think about the death toll. And in both of those contexts, in addition, when we think about the long-term consequences for the regions of those who have been infected and recovered with the possibility of having long-term COVID and other effects on their healthcare, the pandemic certainly represents a major challenge moving forward for the region. As a political scientist, my role in the pandemic and what I'm going to try to concentrate on is we have been trying to do first monitoring of public policies and trying to measure them and look at the variation in the policies that have been responded at the national level, at the state level or provincial level, and the municipal level in Latin America. And I think one of the things that I want to start my comments by underscoring is contrasting what we see in 2020 and what we see in 2021. And there is some marked differences and some changes that we're seeing. And I think one of the things that at the onset, I think is encouraging to see is to see how quickly, even with very limited resources and in a very fragile social and economic context. So if we think about the pre-pandemic context, we had fragile economies, we have large informal sectors in the region, and this means that social insurance is insufficient and really doesn't, many of the workforce, at least 50% in most countries, don't have any income without being able to, they need to work outside of their home and they depend on moving outside of their homes every day in order to secure enough income to feed themselves. In addition to that, we had very uneven developments of the public health system in the region across countries. And that means that if we think about surveillance efforts and laboratory networks, there was very uneven organization and readiness for this type of a threat. And limited but important potential for vaccine production locally in the region that could be a major source of a strength that we had. But we also had really uneven experience in responding to pandemics. So if we think about HIV/AIDS and we think about the response in the region, one of the things that comes across quickly is that many of the times we faced a pandemic, it took a relatively longer time period for governments to react quickly. So one of the major challenges that I think COVID has really underscored is, in contrast to past epidemics, maybe we can think about Zika in the case of Brazil as an exception, but most of the time, major threats, it takes significant months for governments to react. And in the case of COVID, I think we have a lot of evidence to suggest that at the societal level and at the government level, there was a very quick, rapid response in the first months of 2020, realizing the threat and trying to mobilize and implement containment policies, and society trying to stay at home in order to slow down the spread of COVID. But I think one of the things that quickly comes to mind and becomes clear as we look at the response in 2020 is that over time, very quickly, that strong coordination across society and across governments began to break down. And it comes very quickly, and we've talked a lot about it in the case of Latin America, that one of the issues that also becomes clear is that the measures that were implemented in the response to COVID, what was difficult is that often the package of policies that was adopted lacked coherence, lacked clarity, and lacked coordination. And over time, those issues, the lack of coherence, the lack of clarity, and the lack of coordination have continued to be major impediments. I'm going to try to talk about the lack of coherence, then I'm going to talk about the lack of clarity and the lack of coordination. So example of the lack of coherence. One of the things we quickly saw, and I think this is echoes experience in other regions, we've tracked specifically the response in education, and we've detected, and we show it took in some cases over 100 days for remote education programs to be announced in many states of Brazil and municipalities of Brazil. And what happened is, in those periods, we were closing down the economy. We were making very significant efforts to halt the spread of the disease by closing businesses and industry. But at the same time, what was happening in education is that we were really not engaging with students in the public health system, especially in the public education system, for them to receive education. As education started to be delivered, we also neglected to deliver education in a means in which most of the students could access and receive education. We know that there's very limited access, and the students that do access the internet access it in a smartphone. So one of the things that we could have used, we could have reacted more quickly, we could have had a more coherent package. What happened is that in the education sector, and I think the same thing that happened in the region in terms of emergency crash transfers, we delivered to the most vulnerable populations very uneven services. And in the case of emergency crash transfer services, we required those groups to, in order to receive the aid, to leave their houses. So at the time we were reacting and trying to quickly mobilize to contain the epidemic, key groups in society and groups that were very vulnerable, we had a very difficult time with developing policies to ensure that those groups could stay at home and receive education or receive food and sustenance in order to stay at home. In terms of clarity, I think that this is another issue that really bears mention and bears to be underscored. We see that as we think about the population and what is clear in terms of what do we need to do in order to prevent the spread of an airborne vector, we were very unclear in communicating to society what needed to be done, what actions were most effective. And if we look, the consequence of that in terms of public policies is that when we look at, for example, school reopenings and on-site schooling in Latin America, most of the protocols that were implemented emphasized very heavily the use of cleaning physically the schools and thinking about a lot of things with emphasizing sanitizing hands. And we didn't spend enough time talking about ventilation and talking about the issues of monitoring air quality and how that could really be effective in thinking about all the connection into getting children to school. So children in subway systems and public busing, and how we had to think about ventilation as from the moment that someone leaves their house until the moment they're in school, all of the complex policies that we needed to implement to prevent and to protect children, who we have to remember are still a group for which we don't have vaccines authorized and are a very vulnerable group. So we lacked clarity in terms of how to prevent and what are the most immediate actions that we needed to implement. In terms of the lack of coordination, I think that just to underscore a significant trend we saw, in some countries, and I think Brazil is an example of this, we saw that there was a very unfortunate response at the federal level. There was a lack of a national response at the national level by governments. And what happened is that in the case of Brazil, each state adopted their own response to the pandemic. And over time, what we're seeing in 2021 is that the response became further decentralized and is now each local government, each local municipality is designing and has much more discretion about the response. What's the consequence of that? It's very difficult in an airborne case as we have with COVID, for you to isolate your city or your municipality and for you to design a coherent set of practices and policies to protect your local community when you have the influx of goods and people coming in from nearby cities. And so we need a set of coordination is very important, is critical. It's also critical in terms of the political costs, because it's very costly for politicians and for local leaders if each one has to defend their package against neighboring states, neighboring communities that have more flexible or more stringent policies. It makes the negotiation with society and the communication with society more difficult. So I think these are some issues that we've seen that are really challenging for governments in the region, and where we saw a lot of consensus break down over time. There are exceptional cases. I think we're very interested and we're looking at and we're trying to also study. If we think about the case of Argentina, for example, there was a lot of efforts in trying to construct pacts and governors to meet and sign agreements and to work with the national government to try to implement a more coherent package. But I think this is very difficult to do, but we realize that it's critical to having a more effective response. I want to kind of, in the short time I have left, and to just underscore, I think a further challenge on the political side of this pandemic, and which is unanticipated and really kind of historic, is the issue that we have had a lot of difficulty because of vaccines, that different brands were available, and those brands had also different countries who were perceived as backing certain vaccines or adopting different vaccines. And so we've seen a lot of issues in Latin America, and it's very apparent in the case of Brazil, of vaccine branding and the questioning of vaccine efficacy to be tied to specific types of vaccines manufactured in specific countries. And that's made very difficult the response in the region, because in most countries, there was not a single vaccine brand that dominated the strategy that country chose. And in order to quickly vaccinate the population, it became very clear quickly, you needed, what was important is a vaccine rollout that was quick and reached the potentially largest part of the population we could. And that involved a lot of times making choices that were difficult to secure and get vaccines quickly into the country that had varying levels of efficacy, but that together collectively could be really important for protecting vulnerable populations. What's happened though is that we've seen a very strong politicization of vaccines and about specific brands. And as a result, I think that's what's happened is that a lot of the misinformation and mistrust of vaccines is also specific to specific types of vaccine brands. And this is a major challenge, because we have to think about, in terms of the response to COVID, in other epidemics, in other moments in which we had a major health crisis, we didn't have to also navigate through branding and through companies and thinking about how to navigate to communicate to society. On the one hand, vaccines are very important, but on the other hand, deal with this issue. And I think the last thing, elections, just the last thing. We had transitions in terms of governments. So elections took place in many countries across the globe, including in Latin America. And it's very difficult to have elections during a pandemic, during a major emergency, because all of the entire government in society is changing hands. And that happened at the municipal level in Brazil. It happened in some countries like Bolivia at the national level. And what that meant is that that represented another major challenge, because there was, in many countries, several months of uncertainty before the election and after in terms of what we would do and what policies would be enacted. So thank you very much.
Thank you. Thank you very much, Dr. Lorena, for providing that input. And we will definitely come back to this issue of coordination and clarity and coherence, the elements that you identified. So thank you for that intervention. I'm very excited now. The mention of the private sector has already been made, and I'm delighted that we have Peter Albias representing Pfizer. He is the lead patient and physician engagement person for international developed markets. Peter has a lot of experience in this issue, and I'm very excited to welcome you, Peter, and over to you for your opening reflections.
Thank you very much, Adnan, for your kind introductions. And I want to thank you to having me at this panel. Greetings to all my panel colleagues. Now, let me share some reflection. I want to look a bit at this as what is opportunities which I think have emerged out of this crisis, as well as what have we seen coming up as really critical issues and bottlenecks. And just to highlight some of the topics, and as been said before, the issue is so broad. So I'll leave it to a couple of topics, and then happy to get back to others in our discussion. Now, first point I think worth to highlight is that this crisis has led to a very different kind of public awareness on the importance of health as a whole, right? So this topic of how fundamental health is for all aspects of society, right? A fundamental topic, for any aspect, be it economical, social, etc. Everything depending on that. That was not there before, right? Before, health, at least, from our perspective of those developed markets, often looked at a cost, which needs to be managed, but as this fundamental pillar, I think that brings an opportunity with this to strengthen the structures which we have seen are so critical, important in a crisis like this, right? So make systems much more resilient, be it clinical systems, monitoring systems, strengthening all the key workers in the space, physicians, nurses, etc. Also the role of private companies in that regard. I think that I think is a new opportunity. Second aspect, also what we've seen is in our region that we could build on quite a strong academic and clinical knowledge network. There have been lots of interactions and trustful relations built up before, and that has helped a lot to very early on, and I think also consistent over time exchange of information. Working on solutions, sharing ideas. I think that was something which I think has been actually strengthened throughout the crisis, with all the challenges which have been with this. But I think that is something which we've seen can form a core also for future resilience models. And I say this because we haven't seen the same in the political space, right? The interactions across countries has not been to that degree so strong, not early on. It was more individual countries and nations which have been the key players, at least at the beginning. But I think that was still the key determinants over time. So that is also something I think to build on and to learn from. What we've seen, and it has already been touched on in the comments before, how important communication is. And communication on science is not easy, right? Because it is not easy, it's complex. It's sometimes confusing. There is changing information out there, and people who are not used to deal with a scientific topic, find it hard to learn that we get changing perspectives on matters when we learn to move through such a pandemic. So I think this question of how to build reliable, open, trustful, in time communication, how to strengthen and build that up, I think is a key topic. And we've also seen that in the beginning, in the first crisis. Actually, there's a similarity, Lorena, to what you've shared with South America. We acted quite fast, I would say, on the pandemic, right? There was an early sense of, how critical it is. Of course, we had a lead time. We saw China. In Europe, Italy kind of went first, so other countries could see what is happening very quickly on. And it was acted on quite fast in terms of first lockdowns. And to, of course, more or less degrees, the public followed kind of the instructions and kind of being also coherent with the measures in the first lockdown, which happened, took about 6-8 weeks. It was a bit different in different countries. But then, moving on that, and when the pandemic, and when we saw next waves coming, we saw that the consistency of information, whom to trust and how to follow up, that kind of started to erode a bit. You heard different voices. There was, of course, different findings now out there. And then it became much more difficult to keep people really following the measures of the government. So that's something to think through, how to build that trustful, reliable communication platforms that can help us. Another aspect, this pandemic gave a push for digitization. Incredibly, right? Things which have taken years and maybe a decade or longer to start to emerge slowly happen, almost overnight, right? I think that's what we experienced. But to be fair, I think that has not happened by design. It happened kind of by disaster. One must just say, because the pressure was so high. So yes, telemedicine, all those aspects emerged, and suddenly those structures have been built up. But it also, I think, shined a strong light how even very developed countries, like Germany, like others, how much they still fail to really use the opportunities of the digital age, right? In terms of early detection, diagnostics, coherent data sets, right? And all of this. So I think that has also shined a very strong light how important that is. And then there was also another critical important aspect to see how important access to data is, right? Access to reliable data so that you can make your analysis on the data and draw conclusions out of that. Now, early on, Israel was going very early on in regard of supply of vaccine and the vaccination of the population, and also in terms of capturing real-world evidence early on in a study which Pfizer-BioNTech has set up. And kind of the world has benefited from that, right? Because early on we had hundreds, thousands of data early on to see, how is the virus evolving, how does vaccination work, etc. So we could really see how the access to this data can help to protect and ultimately save lives, right? So I think that's a discussion we need to have, how we can ramp up. In the case of vaccine development, I think that one aspect, I think this was all unprecedented, right? The speed, the magnitude of collaborations. It's 320 now, projects going on working on a vaccine. And of course, we have, several vaccines now approved around the world with all the challenges we mentioned, but still they are there. When you look back at the start of the pandemic, this was an absolutely unrealistic case that you would have a vaccine after just 1 year. But I think a lot of this spirit, the coordinated effort, the public-private partnership models, right, which have been worked, the open and transparent collaboration, that has shown what is possible, what we can achieve in such a critical situation, and what we are able to accomplish if all parts work together very closely. So I think that's also something to learn from, and maybe to adopt to other areas as well. And last point also, the pandemic is not yet over, right? We are still in, there's several waves, we all hope not coming too strong, but clearly there's still a momentum underway. What we already see is that, beyond the more immediate effects, which we've seen, there's so much happened which we still need to learn and understand in terms of other effects which have happened. The whole long COVID, right, needs to be explored. How deep? What does that mean to individual health? What does this mean also collectively for public health challenges to work on it. The many people who might have been had traumatic experiences, right, through the pandemic, through the lockdowns, maybe not being able to say goodbye to loved ones who've passed away, psychological challenges of young people, kids and students, being in the lockdown period. There's a huge burden, right? A huge health burden, and we need to get into that as well, understand it, help those people. And that's also something I think which is important for future resilience and the ability to tackle future diseases, that we really take time and effort to understand all of this, right? So maybe just shine a light on those things for the further debate, and looking forward to our further discussions.
Thank you very much, Peter. Really appreciate that perspective, and thank you for reminding us about the other trends, the communications, the digitization, and the value of reliable data. We will definitely come back to some of those. I'm now very excited to welcome Dr. Pascal Alotti. Dr. Alotti is very familiar to many of us in the academic world, is the current director of the International Institute for Global Health at the United Nations University. And I'm so happy, Pascal, that you could join us today, and over to you for your opening reflections.
Thank you very much, Adnan, and thank you to all the colleagues on the panel and everyone who's listening in. The challenge of being the fourth person on the panel is that there's often lots of repetition, but I think what that in fact shows is the importance of the issues that are being raised. What I want to focus on a little bit more is the learnings from this and how we capture this, and our responsibility, particularly given the M8 Alliance, which is the kind of the peak body for the World Health Summit, is ultimately about preparing the future generation. So what do we take from this? And so the underlying the global conversation on the pandemic really is an implied truth of the epidemiological triad: the agent, the virus, the host, obviously humans, and the environment. And that triad gives us the tools to understand and make predictions through modeling about the course of the pandemic. We then infer on the basis of that understanding what the interventions need to be in order to limit or reverse the course. The challenge has always been that in public health and in global health, we have not been particularly good at layering on the systems and the complexity lenses. We are not good at the science of context. We pay lip service to it, but undervalue the importance. So the big science in the R&D blueprints have to do with the technological fixes. And these are the big solutions meant to deliver the greatest good for the greatest number of people. But we also, perhaps disingenuously, then tag on the need for equity, the need to leave no one behind, the marginalized and the outliers. And this pandemic is holding us to account. And it plays very clearly in some of the country responses. And this means that we need to look and listen and appreciate the value of what we see and hear and learn from it. And then we have the responsibility of thinking about how we teach it. So undoubtedly, I mean, we all start off with this at the same point. We clearly, in the pandemic response, are interested in alleviation of suffering, avoiding premature deaths, ensuring some quality of life. And for these goals, we have the peak health body, WHO, that worked tirelessly to coordinate the science. We saw amazing generosity from the research and knowledge brokers. And in many low and middle income countries, there has actually been some effort to establish the infrastructure for the translation of the evidence. And this, I think, again, as Peter said before, that there are a whole range of new things that have been escalated as a result of the pandemic. And if we are sensible, we will keep this infrastructure going towards the future. But from a certain point, the political processes kick in and political choices necessarily have to be made. So the differences in responses, if we try to put a kind of a critical academic lens on the learning, there are a number of factors, and I'll just pull out many of them have been, or most of them in fact, have been spoken about by previous speakers, but I just want to pull out 3 examples. The lockdown. the balancing of the need to keep the economy going versus the specific suite of interventions entailed in the various levels of lockdown as a measure to ease the pressures of the health systems. Now, it was very clear that everyone would need to make some sacrifices in the interest of control. So the point at which we were thinking about lockdown, it was about people, but we didn't consider the science of working with people. So, however, a lack of knowledge of, or maybe deprioritization of particular communities really exacerbated inequalities. Given the informal nature of a significant proportion of the workforce, for instance, including migrant workers, the idea of working from home made life untenable for so many people. One of the images seared in my memory is of a queue in Kuala Lumpur that stretched for blocks and blocks after the first lockdown. And it was people heading towards a pawn shop because after several weeks of being unable to earn in the cash economy, people were out to sell off anything of value that they had in order to feed themselves and their families to keep a roof over their heads. Similarly, we know, and as has been mentioned before, that keeping kids from, who knew, to be sarcastic about it, that keeping kids from school, particularly in patriarchal societies, is likely to drive up the rates of child marriage or school dropouts or increase mental health problems. And would increase physical, sexual, and psychological abuse and violence. But we do have the methodological approaches to be able to investigate and contribute to the evidence on working with communities and families as part of a sustained effort to build and maintain resilience in the face of these crises. So what lessons are we going to take from this now into the future? We do need to make sure that we're learning from them. The second example quickly is the vaccine rollout. So beyond the larger discussions around vaccine equity at the global level, which I'm sure will come up several times in the summit, and I hope will come up several times in the summit, there are also the national level considerations of access to populations within the country. Now, how countries have prioritized vaccine rollouts is very much locally determined. In some countries, the elderly, for instance, were deprioritized in favor of the working age population. These choices have a lot to say about the local, and we still have a lot to learn collectively about the impact of these choices as opposed to other choices that were made and the desirable outcome or otherwise. There's also a lot to be learned from changes in vaccine uptake. When the vaccines were available in Malaysia, for instance, when it started, there was some unevenness in uptake based on the different vaccines, as my colleague from Brazil had mentioned, depending on the brand and so on. And in Malaysia in particular, there was a bit of a challenge with the uptake of AstraZeneca, largely because of the uncertainty in the early days of the side effects. And then in May, there was a sudden escalation in the daily case rates, and it had a huge impact on uptake. There was the demand was suddenly so high, a clear tipping point. But that still leaves us with not understanding who is still left out, and we need to see all of this as important parts of data for our learning for the future. And as we begin to engage more globally, it's interesting to see those for whom life has regained normalcy, as long as they can show that they've been vaccinated, but also the risks that we're creating further inequities by denying people access to spaces because they're unvaccinated, particularly if they don't have a choice in being able to, or they don't have access in order to get vaccinated. And the final point that I want to make is on information and communication, again, a point that has been raised, that there is so much to learn from how information flows have been managed. It's been amazing, for instance, totally out there, how art forms have been deployed. So in Ghana, there are wax prints that give information about the lockdown. Ministries of health in some countries in Asia have commissioned and used local art forms and TikTok messages to reach different demographics in the population. They've used mobile apps as well. And these all require preparedness to listen and to respond to the needs of the local population. And it requires engaging with the population to make them core producers as well as consumers of the messaging. But the consumption of the information has also been incredibly political, and so much depends on the messenger. We've analyzed, for instance, the national presentations of a number of leaders as they spoke to the nation about the pandemic and how the pandemic was going to be answered and what the response was going to be. And the response in terms of compliance and civil unrest was very much determined by the calmness, the authority, and the approval ratings of the leaders. So there's a lot about leadership as well that is an important part of and an integral part that has to be a part of how we manage this. And obviously, with no bias, I have to say that it's totally weighted in favor of women leaders. So there is a paper by Victoria Haldane and colleagues that was published in Nature Medicine, and one of the critical background papers towards the independent panel on pandemic preparedness and response, the IPPPR report. And it bears out the challenges of the primacy of purely epidemiological approaches and the need for methodological pluralism to actually engage better and begin to provide us with the evidence for the learning for the future that might also be transferable to other disasters, because the other disasters will come, and we need to make sure that we're clever about it. Thank you.
Thank you very much, Dr. Alotti. That was a great reflection, and I hope we have the time to come back to your examples of the tagging of equity onwards and the role for communication, especially the messenger, the role of the messenger. Thank you so much. I'm now very honored to introduce our final panelist for today and opening reflections by Dr. Ole Oderson. Dr. Oderson is not only a scientist, but currently president of Karolinska Institute in Sweden and a member of the M8 Alliance as well. Dr. Oderson, over to you for your opening reflections.
Thank you, and thank you also for the invitation to take part in this very important session. And a big thank you also to my fellow panelists, because they raise very important questions that we should not only discuss at this particular stage, but perhaps in years to come, because it will take years until we know exactly how we should learn from this pandemic in order to be better prepared for the next one. So this is a long haul, but it's a good thing that we have started on this process. So it's true, I'm the president of a medical university, Karolinska Institute in Sweden. And needless to say, we have been pretty busy during this particular pandemic, trying, as many of you said, to move from uncertainty to a sort of evidence-based approach to this particular pandemic. I should also tell you that I was chairing a Lancet commission on what is the main topic, I think, of this discussion: inequities in health. So the Lancet commission on the root origin of inequities in health was something that really inspired me also to go into a discussion and also into a more dedicated research on what has happened during the pandemic. So inequity is a keyword, absolutely. And I think what we need to take with us before the next pandemic hits is that we haven't really been concerned enough about all the inequities that we see in health in the world today. What we have seen during this pandemic is that inequities have been exacerbated. They have been to the detriment of populations and communities, particularly in low and middle income countries. I would like to refer to, in fact, a preprint that I got yesterday. It's a Lancet preprint, so it has not been peer reviewed. I should remind you of that. But this preprint serves as an excellent example of how a pandemic hits when there are inequities, not only when it comes to economic resources, but also when it comes to the strength of the health service system. This preprint says that there was a tremendous decrease in essential health service utilization during this crisis in the period between March 2020 and June 2021 in low and middle income, low middle income countries. And some of the figures that are presented in these numbers, that are presented in this particular report, deserve to be lifted and put to the table in this discussion. The increase in child and maternal mortality that can be ascribed to a decrease in essential health service utilization amounts to 2.6 indirect deaths per COVID-19 death, officially reported, just in the field of child and maternal mortality. This illustrates how such a pandemic hits unevenly, and particularly it hits low and middle income countries. What we need to do, and this is my main message, we must not now only focus on the here and now. Already we must look ahead and develop what we call a universal preparedness for health before the next crisis hits. And we haven't as yet mentioned what could be a driving force here, and that is the UN's Agenda 2030, because it's a fantastic recipe as to how we should move along to reduce the inequities that have made this pandemic such a, you could say, unreasonable attack on the low and middle income countries this time around. What we are doing at the Karolinska Institute now is to establish a center that we call Health Emergency and Pandemic Science Center, where the whole idea is to see how could we utilize the entire life science sector, including the industry, the universities, the healthcare sector, to be much more creative as to what is needed to build now before the next crisis hits. Not only build back better, but to build back fairer. And since we have distinguished panelists here from Pfizer, I think, hope you agree with me that this time around, when we have had to resort to solidarity in order to distribute vaccines to also the part of the world that is not in itself producing vaccines, and Africa, of course, produces only 1% of the vaccines that it administers. We have to build production facilities in all the countries and also in Africa. And this, I hope, Peter, we could agree upon, that the entire life science sector with the industry included could see to it that we build production facilities for medicines and vaccines, for example, also in Africa. Solidarity is not sufficient. We have seen this through the failure of COVAX to adequately cover the need for vaccines in low and middle income countries. So these were just some of the reflections from my side. Inequity, that's the key word. Time dimension is important. We have to look ahead. And the third thing, of course, which is a very sad thing, is that when a crisis hits, we see that solidarity just doesn't keep up. Thank you.
Thank you very much, Dr. Orderson, for those comments and for reminding us about the fundamental role of inequity, as well as you call it, the time dimension and both the strengths, but also the weaknesses of the concept of solidarity. So, ladies and gentlemen, first of all, a reminder, our panelists have provided their comments, but we would love to hear yours. The Q&A function is available to you. Please put your questions or comments in the Q&A section, and I will be very happy to read them and direct them to our panelists. I will, as I'm waiting for you all to jump in, I've been fascinated by all 5 introductions, and I really want to engage. I want to quickly go to Dr. Yoti first, because he talked about specifically the costs to society. And so, Zabulon, I'm wondering if you can elaborate how, from your perspective, particularly a WHO perspective, you have recommended to countries to negotiate, on the one hand, very good control, preventive control for the pandemic, versus what you call the costs to society, and you gave the example of lockdowns and economic implications. Could you reflect just for a minute or two, because I want to get to many questions. I'd like my panelists to please be brief in their responses, but how are you advising countries to think through that?
Thank you. Excellent question. the worst one can do is to just count cases and deaths and say that is the loss. The cost is more than that. We have to critically look at balancing between COVID response, COVID control, and livelihood. We have already seen clearly that in Africa here, other diseases kill more than the COVID itself. That's if you look at just deaths and cases. But otherwise, the costs associated with the COVID goes beyond just sick people. It goes to breaking down the fabric of the society. We have already given, all the panelists have agreed that the lockdowns, which were done with good intention, had really some other consequences which were not good at all. Think about the cost to children who have stayed at home, the brain development. Think about the future human resource capacity in the world. These countries where learning from home is a really challenge. Think about really the women. Think about the marginalized who are not able to access the available services beyond those provided as an opportunistic kind of thing because of COVID, plus also those which they are not accessing, which they were supposed to. We have just had the impact on vaccination. Fewer children vaccinated means the scare of measles is now bigger. No malaria treatment means that now the malaria is going to kill more and more. So the real cost of COVID is not easy to estimate, but it is huge. The disease aspect of it is huge, but also the socioeconomic side of it. I'm not an expert in that, but I know that the economies will take a lot of time to recover from not only the impact of COVID response, but also the actions we are taking now. And if we are not learning, carefully from what we are doing in the response, we can cause more damage. Therefore, my point here is really to have a careful balance between COVID measures for COVID control and livelihoods. We need to center on the person, not on the virus. Thank you very much.
Thank you, Zabulon. And I think you're pointing out, so Lorena, in some ways, what Zabulon is saying is actually true, that there are real disagreements between even technical experts on the value of interventions. He's mentioned one like lockdowns, and there are many other interventions, which I think lends to your point about coherence of messaging. Because if reasonable experts actually disagree, and we saw this in both low and middle income countries, but also high income countries like the United States, where in fact it has become very politicized. So talk to us a little bit more about these real technical disagreements and how they might have lent themselves to a political overtaking in the coherence aspect.
Yes, I think that this is an excellent point, and I think something that we've been monitoring a lot inside Brazil, for example, because we've been looking at most typically in an emergency, what happens? Governments adopted an emergency crisis committee, and they called experts into this committee, which use and this is really important to the response to COVID, because in these crisis committees you debate what policies are going to be adopted and why. And but I think one of the things that's critical to talk about is that the evidence in order to make decisions and to debate was very limited. And I think this is one of the things that really made difficult that in order to, for example, if we think about a lot of the issues with mask mandates, and right now in Latin America, there's a lot of controversy about if we should remove the mask mandates, if we should keep them. It's very difficult because we have to think about a lot of the evidence that we have about the efficacy or not efficacy. We don't have research, or we don't have specific studies that we can call upon and look at and say, in this context, it really matters in Latin America. Look at this study in the specific country. So I think evidence, this is one issue that we really need good data and evidence in order to have these debates. I think the other thing that we saw in Latin America, and I think this happened in some other countries, is around prevention treatments. And there was a lot of controversy about what drugs work for prevention. And This disagreement continues right now in Brazil. Doctors disagree about the authorization of preventive treatment in Brazil. The National kind of Council of Physicians had a tied vote around preventative treatment last week. So I think this is important to underscore and to realize that we need a lot of work to be done about moderating and having discussions around when there is debates, how those debates occur within closed groups and how they're circulated to society has a huge impact. And society, a lot of the times, is following that discussion.
Yeah, no, absolutely. I think that's a very valid point. First of all, a reminder to our attendees, if you have a question you'd like us to debate, please put it in the Q&A chat. It's very important that if you have a thought, a reflection, doesn't have to be a question, please use the Q&A function, and I will keep an eye on that. But Peter, the private sector is very much part of society. The private sector is also very much part of the response. You pointed out, very importantly, two themes of both communication, but also digitization. So can you reflect a little bit more on, as you hear the role of communications, what do you think is the private sector's contribution there?
No, I think that the point on communication, though, the key question is, how to really create trustful, reliable platforms, right? Which kind of, refer to the state of knowledge, right? Which is out there. And I think the key point here is this needs to be diverse, and also we need to enable that diverse views and perspectives are shared, knowing that this is sometimes confusing, but it is important for the trust, that you really make sure you have a broad coverage. So that's why I think that every part, of course, first and foremost, the academics, leading academics and institutions, science needs to be part of it, but all other areas as well, including the private sector. I think we need to get away from a point, where we are so shy because there is a private company earning money with a vaccine. They shouldn't be part of the table. Everybody knows it. We need to be transparent about it, but we need to create inclusive environments around this communication because we have a lot of knowledge to share. And we've done so from our part, but I think it becomes more powerful when those platforms are joined up, right? And also allow for controversial discussion. I think that is a key component. I think national academies of science could play a role. I saw that evolving in Germany, where they started to play this role, and that might be a concept also for a more internationally led conversation platform for the public. I think a good example, actually, maybe that worth to point out, is also Professor Christian Drosten, well-known a virologist. He has set up a podcast, by the way, which was an unusual way. We didn't do that before, but it has contributed at the beginning a lot to a more, speaking also, directly to the population, helping to get a better sense and understanding. So I think those elements maybe could be complementary ones as well. And then, the other aspect of all that's a broader discussion. I think we've just seen that we cannot afford to have, rules and regulations in place which protect data, but actually don't protect people. This is something we need to get into. So I think the key topic here is that we see that the medicine of the 21st century is heavily dependent on access to data, to big data, and be able then to analyze it with machine learning and all the opportunities we have today to see patterns early on. So we need to really come to a point where we build those data spaces and we define the rules on access to those data, ensure protection of the data and safety of that. There's lots of initiatives underway on a European level, but I think that's a critical one for us.
No, thanks, Peter. And I will come back to one or two things that you've just said, but in a sense, you're raising the issue of trust. So Pascal, from your viewpoint, and particularly, from the perspective of that mistrust and misinformation has been actually now a currency in the COVID-19 responses. It has been used to actually create, by intention, develop mistrust and distrust of both the message and the messengers around this. So could you reflect a little bit about that and what role it has played in national responses?
So I think that is such an important point. Again, just to labor the point a little bit about the importance of making sure that we integrate this into our teaching of students for the future. That trust has become such an important part of political engagement, and it is very heavily intertwined with information. So you have, for instance, and this is work that has been done quite extensively by people like Heidi Larson, for instance, in the Vaccine Confidence project. And there've been some really interesting dialogues through Wilton Park on and engaging with the social media and all of the different ways in which information changes. So that there is now a point out, and together I think as well with populism in politics. So there is a point where at which depending on people's trust in the individual, they will take on whatever that person says, regardless of the veracity of the information. So now it's not just about the message; it is absolutely about the messenger as well. So even if it's somebody who is politically unpalatable, even if they're saying something that's right, people are more likely to dismiss because it came from the person, that person in particular. And I think there is some value to being, I guess, a little humble, all of us, including our leaders, about which messages are important to come from them, as opposed to having somebody else be the messenger, to be very clear and to be able to communicate the information that people need. I think it is something that is of very real concern, because there is a lot of advocacy, because there's a whole lot of social movements and so on, and people will pick a single issue and drum that single issue, and suddenly that gives them a level of legitimacy and trust with a whole constituency that has nothing to do with the level of expertise they bring to the topic. Again, it opens up a whole area that we need to understand much better and engage with if we want to be effective in our messaging.
Thank you very much, Pascal. And I will definitely reflect a little bit on what you just said, but critical important to understand this notion of trust and science, and is building on decades of sometimes, particularly in some countries, decades of a very harmful relationship that then integrated into the current pandemic situation. May I remind, I see that somebody in the attendees has raised their hand, but I don't have the capacity to unmute you or allow you to speak. I'm afraid, I think I need you to put your question or comment in the Q&A chat. If you would please, a reminder, we are going to be coming up to our last 15 minutes very soon. If you have a question or a comment, please go ahead and type it out in the chat board function. I'm going to request our technical support to contact one of our participants who wants to speak. If you could guide them, please, to put their comments on there. I don't have a chat function either, so I can't communicate in writing, but please use the Q&A function. While I turn to Ole, because Ole, you said something that really stimulated my thinking on, I think some of our best learning is done through failure. And I think that you talked specifically about failure of COVAX or something related to that statement. Could you reflect a little bit more on that and talk to us about maybe one or two other lessons we can learn from what you might consider failure, either of a facility or an organization or a country's response?
Yes, COVAX was a great idea, and it still is a great idea. But what we see, and I think several of the panelists alluded to this, is that solidarity simply doesn't work under such a crisis. We have vaccine protectionism, nationalism, and understandably so, because it's quite clear that governments sees it as their primary responsibility to take care of their own population. So there is no surprise here. But this means that next time around, we cannot really base our strategies on the solidarity concept. And this is what I see as one of the major challenges now to reduce the technology gap between different continents and different countries. Of course, you cannot have vaccine production in every country, but you can have vaccine production in every region or every continent. And this is really what I see as one of the most urgent issues to attend to just now. As I said, that is a case in point. Africa still has a very low vaccine coverage. And as I said, only 1% of all vaccines that are administered in Africa are actually produced in Africa. That was the figure, at least that was relevant a few months ago. So we need to step up to this challenge. And this, as Peter Albies pointed out, that academia must take responsibility. And of course, I see that we must take much more responsibility than we have done previously to see to it that we can reduce this technology gap. But this has to be done in collaborative with industry. And I think that industry has, to a larger extent than today, to make use of the triple bottom line concept. And of course, this is something that is very up to discussion now, to not only look at the shareholder value, the stakeholder. So what I welcome with discussion, for example, with Pfizer, is to see how the entire life science sector can work together jointly to increase the production capacity in other countries.
Thank you, Ole. And in fact, I want to pick your comment on vaccine production because one of our participants is specifically asking us to reflect on that. And Peter, maybe you can start with that. How do we ensure vaccine production in the South, particularly in low and middle income countries, independent vaccine production, and from the perspective of the private sector, to ensure that that is done in a fair and equitable manner? What are your thoughts on that?
No, absolutely, and I want to build on the the points Ole made, and I fully agree. I think that needs to be the future way. We all need to step up and work on that. This capacity infrastructure technology is being developed across the world in all parts of the world, because otherwise, and I think I share the same conclusion, it will be as difficult again maybe as it has been for many of the reasons being mentioned. I think the key point here, as I see, is where to start and how to start, and just want to make the point that we made a first step in that regard. So Pfizer and BioNTech, have started to work with the BioVac Institute in Cape Town, the BioVac biopharma company in Cape Town, to work and build up a production and distribution facility. Right. So I think that is exactly the first steps now we further need to take. And I think we've been one of the first, who started to invest in that and work and pave the way. And I think back to that broader topic, the triple bottom line concept, I think that is pretty much, where, we as a company and others also start to get to. I think, back to the start of the pandemic, just remind ourselves the likelihood of success for a vaccine at the beginning was very, very, very low. If you would have applied just the math of profitability, you probably would have not gone for it in those early days, because it was huge investments. It was a very high risk area. Of course, in our case, it has turned out to be successful. But I think a lot of the ambition has been driven by the conviction that we have to take a part to fight the pandemic, right? In a broader sense. So I think that is evolving, and I see this as a joint effort of us. As the private sector, but also together with governments and with academia in joint efforts to build up these technology transfers further down. But definitely from our case, we've started to go the way, and we are happy to move further on.
That's really, really good to hear. But Lorena, from your perspective, are governments going to welcome this? Are governments geared towards partnering, whether it's PPPs or other mechanisms, or promoting independent production? Just to complete this point.
Yes, I think, governments, at least, for example, in Latin America and in Brazil specifically, we saw that happen, right? The problem is, or the challenge is, you have to bet on the technology that you think is going to you have to do an early bet, which you don't know exactly what's going to happen. So we have Instituto Butantan is collaborating with Sinovac. Fiocruz has an agreement with AstraZeneca. We now have the case in Argentina, several companies that are starting to develop Sputnik and also starting with Moderna. So we're starting to see some of this. But I think the really hard part is in the beginning, each country and each government has to navigate and decide on where to make the bets. And I think this is something that it's too, in a health crisis and an emergency, with the lives that we have lost, there's too many costs involved of letting that process we have to think about incentives and ways to share information and facilitate that we invest our efforts collectively to get together to save the most amount of lives. And instead of kind of each out for their own and see who bets on the best, who makes the best bet. Sure. That's the challenge, is how do we build into that system incentives to share information early and work collectively together?
No, thank you. I think that's very, very important. And I'll bring in Pascal now, because Pascal, one of our participants, has also raised this notion of capacity development, but from the perspective of using online methods and online training and tracking responses. So certainly from an academic as well as from a global perspective, would you like to reflect on that? I hope Pascal is still there. There she is. Lovely. So how do we ensure the use of this technology to support capacity development in LMICs in particular?
The technology is, it is still a bit tricky because access to the internet is still not as wide as we would like it to be. So I think, but that's not to say that we shouldn't start investing and we shouldn't start working towards it. My concern primarily is about the content and how we deliver it, and I think the technology is just a means, and there is a risk of chasing the technology, which is not a solution. It is a means of delivering the solution, and I would therefore still focus again on us thinking very clearly about the content that we need to deliver to our participants.
No, thank you. I think that's a great warning that one assumes the digital equity, which unfortunately does not exist. I'm actually going to start winding down the session after these very interesting responses, and I'll start with you, Ole. Take a minute to provide your closing reflection, and maybe you can also go back to your fundamental notion of equity as you provide your closing comment there. Over to you, Ole.
Yeah, thank you. Very briefly, I think we all should have a closer look now at UN's Agenda 2030, because as I said, it contains much of the recipe as to what needs to be done now to reduce the inequities that make this pandemic hit so unevenly and unfairly in the world. So that's one take-home message. The second take-home message, which I think is extremely important, I'm very happy to hear what Peter Albier says about this, is that we need an alliance now between the healthcare sector, the private sector, and academia to look at the long-term perspective towards the next pandemic that we now will come eventually, to see how we can reduce this technology gap that we have been discussing, and other gaps also between different countries. The third issue that was not really put to the table, but I will challenge those who represent WHO here, is that next time around, there must be much more evidence available when recommendations are issued, because what we have seen this time around is that you cannot have a standard set of recommendations from the WHO when it comes to lockdown, for example, because the recommendations that don't work in some countries while they work pretty well in others. We have to have tailor-made recommendations. So this is a very strong take-home message. Next time we must be much more specific when recommendations are put to the table. Thank you.
Thank you. Thank you very much, Ole. And again, my dear panelists, just keep within 1 minute because we're winding down our time. Pascal, over to you next for a closing reflection and maybe focusing as well on your fundamental point about the need for engagement from the South.
So just drawing on the previous message as well, that we have an opportunity to learn from our successes and failures. I'd love to see this translated into a transformation of our curricula and our ways of teaching future generations to reflect the value of knowledge and ways of knowing across different sectors. Now, all indications are that the changes are going to happen across several areas, and we need to make sure that these are part of global health and public health teaching, how evidence is generated and consumed, the role of politics and multiple interests, the role of the private sector and philanthropy, the use and abuse of power, and the impact of all of these on other global threats. We have to bring all of these together. Thank you.
Thank you very much, Pascal. Peter, for a final closing comment.
No, I strengthen this topic of your ongoing, agile learning, which is the key topic here. And I think I would maybe emphasize two aspects. One is that, with the increased awareness on health, that we now truly take the opportunity that those investments in critical infrastructures are accelerated wherever it's needed. And second is that we really build these resilient collaborative relationships and systems across countries, which enable us to act agile when the next crisis comes up. And one more point, with elections going on and other stuff, things will diminish. We'll need to keep the alert up.
Yeah.
Ongoing business. Ole said before, learnings will unfold over years, and we need to constantly learn and build on those.
Thank you, Peter. I was going to go to Lorena, but I see she's dropped out. Over to you, Zabulon, for a final quick reflection.
Thank you. It's not yet over. We still have much more to do. So all these learnings to be really included into what we are doing. So first, commitment to equity in response to COVID-19. And of course, in all areas of health, we really need to keep the world safe, promote health, and using all these learnings we are doing. Then secondly, for future resilience, the world must be committed to health for all, not health for some, health for all. And that needs commitment in terms of investment in all areas of health, including nutrition, including better community engagement, including addressing messages by the right messengers. So thank you very much.
Thank you very much, Zabulon, for that. And I'm sorry that Lorena dropped out. Ladies and gentlemen, let me begin to close this session by saying that, first of all, I think that we've really just touched the tip of the iceberg, so to speak, of learning from national responses. I'm not going to try and summarize this, but let me say that learning impacts all sectors. No sector has performed supremely so well that we can pat ourselves on the back and be extremely happy with this. That's true for governments. That's true for international organizations like WHO. That's true for academia, and that's true for private sector. So together, we have the possibility of learning. Second, what I'm hearing is the notion of humility. All sectors need to have some humility in terms of their working towards developing systems, developing communication strategies, and developing evidence-based interventions for pandemics. I think third, the role of information, evidence, mistrust, and misinformation is really been important and highlighted, I think, in the context of COVID-19. I will say that what is fundamental here too is that the world has seen how the political determinants of health have really interacted with the social, cultural, and science-based determinants of health as well. And in many, many countries, including my own, and I sit here in Washington, DC, the capital of the United States, we have seen that infusion of the political, the evidence-based and science. And I think this has really created those contexts which we have all talked about in other situations, but now are talking about in the context of COVID-19. So with a tremendous thanks to all 5 panelists who represented a diversity of sectors and disciplines, I think this has been a very rich, engaging interaction. I want to thank the World Health Summit and the organizers for organizing this and for allowing me to chair this wonderful session. I hope that you've been able to learn from many of the interventions here. And I hope, most importantly, that this dialogue will continue, not only there in Berlin, in the corridors, but also on social media and in many other forums. Thank you very much for joining us today. Be safe, be well, and let's continue the fight against COVID-19. Thank you. Bye-bye.